Hi, I'm Dr. Decruz, consultant orthopedic surgeon, pain intervention and spine specialist. When we talk about slip disc, it's basically the gel in between both the vertebra. For example, this is the vertebra. The disc is in between two vertebral bones, which is in between here, and every vertebral bone has a disc in the middle, and this acts as a shock absorber. There are many reasons why people get lower back pain. Most commonly is seen in middle-aged group. There are many causes, like those who are involved in heavy manual work. Sometimes certain sports activity predispose them to lower back pain. Even sedentary work life, people who always sit down for many hours, they tend to get back pain. So I see more patients, more people coming in with lower back pain as well as back pain. So this is how the disc bulges and injures the nerve. So as you can see, as the disc goes back during the procedure, the nerve is relief of the pressure. This nerve is free. But if you do not do anything, the disc continues to press on the nerve during prolonged sitting, carrying heavy loads of things, and this constant pressure of the disc will eventually cause pain and numbness in your back and your legs. When you have a slip disc, 99% of the time it is not life-threatening. You will not end up getting paralyzed or you won't be able to walk in future. Only 1 to 2% of time it's life-threatening, and that's a condition called cauda equina. That is a surgical emergency, but besides that, most of the time you do not need to go in for an emergency acute surgery. You need to see an orthopedic surgeon, get yourself properly diagnosed and get proper treatment. It is relatively safe and it doesn't cause any life-threatening urgency. There are very simple things that we can do to avoid or maybe prevent it. For example, you can do stretching exercises, the posture that you sit, those who are working, the sitting posture, ergonomics, the way we sit, the way we stand and do our work, the way we carry heavy things. All this is important. When you talk about treatment, you can opt for some medication. The general practitioner or even the orthopedic surgeon will start with some basic medications, painkillers, muscle relaxants, and something to help you with the nerve related pain. And then you can look at going for an option of physiotherapy. Physiotherapy also is a very important integral part of the treatment for lower back pain. After that, if the patient still complains of lower back pain or neck pain, then I will plan for an MRI. Based on that MRI, we need to see what exactly is the cause of the pain, what is the root of the pain, what is the source of the pain. And after that, I will decide, I'll discuss with my patient the options available. Most of the time, there is no role of surgery. We have a lot of advances nowadays when it comes to pain intervention. We can help the patient to relieve their symptoms, their pain, their numbness, with certain specialized injections and certain procedures, which I can come back to it later. So there are a number of procedures that we can do. For example, I will just show you what happens in a slip disc. So this is the bone, this is the nerve, and this is the disc in between the bone. So when you have a compression, the disc expands like this. So when this happens, there is a lot of inflammation around the nerve. So few basic procedures that we do. One is we do, of course the patient will be under anesthesia or deep sedation, so the patient will not experience pain. We do some injections which are highly specific called radio frequency ablation. Those are injections that block off the pain signal that is coming from the joints around here. The facet, this is called the facet joints. So we do specialized injections that take the pain away from the facet joint. Next, we look at the disc. If the disc is bulged and protruding and hitting one of the nerves, so we can do what we call laser discectomy or laser decompression. So what we do is we put a needle from the side, we put the needle inside this disc and we apply some laser. So with the laser application, the disc shrinks. At least 50% of the disc shrinks, and when that happens, the patient gets good pain relief. all the inflammation around the nerve is eliminated. Another way of doing a small injection is by doing what we call epidural injection. Those injections are put very near the nerve but not in the nerve. So when we go very near the nerve, we can administer some local anesthetic and steroid. So during that procedure, the local anesthetic and steroid will reduce the inflammation as well as the pain for the patient. As a conclusion, slip disc is a very, very common disease. It's very, very treatable. A lot of patients get good relief based on the diagnosis and based on the treatment. The most important is we need to know where is the pain coming from, where is the pain generator, and once we ascertain exactly where the pain is coming from, then we can do the proper treatment. And most of the time, 90%, or I can say even 95% of the time, you do not need surgery. You can do with medication, proper physiotherapy, and some specialized targeted injections. And most of the patients benefit from this. If you have lower back pain or neck pain, you can always come to the hospital to get good medical advice and seek the proper treatment as soon as possible. Thank you.